Hey, Grandma, you want the vaccine? Sorry, you have to go to jail. Tens of thousands of inmates in Massachusetts prisons will reportedly get their COVID vaccines in February before home health aides, senior citizens, and medically vulnerable residents. Squad member Ayanna Presley's fine with it. She wants to make prisoners a priority.
I'm going to continue to fight for our most vulnerable communities who have been disproportionately impacted by the virus, for our healthcare workers, for our essential workers, for incarcerated men and women to be prioritized in the distribution of the vaccine.
All right, so Katie, out of the 12,000 fatalities they've had in Massachusetts for COVID, only 11 of them have been prisoners, and 97% of prisoners are under 65 years old. I don't know how vulnerable they really are.
Well, Jesse, if they're willing to keep them in prison instead of releasing them like they've been doing by the thousands in places like California, then maybe it's something we should look at. But the broader issue here is that social justice ideology has bled into vaccine prioritization, both on the federal level with the CDC and on the state level. State governments have a lot of power when it comes to who gets the vaccine in their state and the prioritization and who's in line first. But the fact is that CDC data shows the most vulnerable people for this virus of death are the elderly population. And yet we have Ayanna Presley and university professors who are advising CDC panels about who should get the vaccine first, saying that we should look at race and other factors rather than just who is most vulnerable of dying of this disease. And that should alarm everybody, because they're choosing based on some social justice ideology, not based on science or health data, as you just pointed out.
Well, the science shows this, Tyrus, and this is what the feds are doing. The feds are giving the vaccine to prison guards and prison staff before they're giving it to the actual prisoners. Massachusetts is flipping it. I don't know why. Do you?
Well, some of that has to do with the social justice issue, because unfortunately, minorities make up about 20% of the population in Massachusetts, but we represent 50% in the prisons. So, I guess in some whacked out mold of justice, you're kind of helping minorities by giving vaccines to prisoners. I think the point in all this is we have to make tough decisions. We have to stick, since we've literally beaten the whole thing about we need to stick with the science, go with the science and figure out what's best. Because here's another thing. Prisoners are reluctant to admit if they have symptoms because they get put in solitary confinement. So which are you going to vaccinate everybody? Or you're just going to whoever has it? I mean, there's so many things there. Instead of going by, I think, looking at age, looking at susceptibility, and those type of factors, and taking care of our essential workers first should be across the board.